Hi, Greg.
Do you hear me? Hi.
Yes.
Okay. Clear?
Yes, yeah.
You. Thank you.
Copy. Good afternoon, I'm Charles Lejano. This is One News Now. Malacanang is calling on critics of the government to open their eyes and see the country's improving COVID-19 response. This after Vice President Leni Robredo criticized the Duterte administration's priorities amid the health crisis. Maricel Halili with the report.
Alam mo, Leni, kung gusto mo, if you really want to do away with the COVID, isprehan natin itong Pilipinas o Manila ng pesticide galing sa eroplano para patay lahat.
That was the sarcastic response of President Duterte to Vice President Leni Robredo's comments on the government's handling of the COVID-19 pandemic. In his taped public address on Monday evening, Duterte insisted that the administration has been doing everything to address the health crisis.
Huwag na ninyong palakihin ang problema. Do not add something to the pandemic by making such reckless statements that we are not doing enough.
His spokesman Harry Roque said Robredo and other members of the opposition have already turned blind despite the improvement on isolation centers and testing capacity, among others. Vice President Leni Robredo earlier expressed displeasure over the efforts to dump dolomite along Manila Bay. This, she said, as the government grapples to fund the country's COVID-19 response. President Duterte brushed off these remarks and instead congratulated Environment Secretary Roy Cimatu for doing the job. The temporary opening of Manila Bay over the weekend resulted in overcrowding, making it impossible for onlookers to observe physical distancing.
Now people now are really enjoying the reclaimed area with the white sand, maski na papano.
Also during his speech, the president explained his reason for allowing more health professionals to live and work abroad. Still, he appealed to them.
Sana yung iba naman will have this spirit and the fervor to serve the Filipino people, because we also need help and we have a crisis also to deal with.
President Duterte also took the time to acknowledge the efforts of the Office of the Ombudsman to prosecute erring officials of PhilHealth. For News 5, Maricel Haridi, we are One News.
Malacanang appeals to testing laboratories to lower the cost of RT PCR tests. Palace spokesperson Harry Roque made this remark after the Health Department urged President Duterte to impose a price cap on swab tests. Roque said the president will likely issue an executive order on the matter. Palace mouthpiece also enumerated 15 hospitals nationwide, offering RT PCR tests ranging from 1,750 pesos to 2,000 pesos. These include the Philippine Children Medical Center, the Jose O. Lingad Memorial General Hospital, and the National Kidney and Transplant Institute. He also mentioned the Lung Center of the Philippines, the Vicente Soto Memorial Medical Center, as well as the Eastern Visayas Regional Medical Center. Likewise on the list are the Baguio General Hospital, St. Paul's Hospital in Tacloban, and the Cebu Molecular Laboratory.
Napakadaming laboratories, gobyerno po ang nag-donate o kaya pribadong sektor ang nag-donate ng makina at mga test kits. Ibaba nyo po ang mga presyo. Alam ko po may mga nagnanais sa inyo, bagamat non-profit kayo, na kumita. Wag naman po. Ibigay na po natin sa taong bayan yung benepisyo pag kayo po ay nakatanggap ng libreng makina galing sa gobyerno o sa pribadong sektor o mga libreng mga testing kits.
Health experts are urging policymakers not to ease quarantine restrictions just yet. To give us details, Greg Gregorio joins us live from Antipolo. Greg, what are the sentiments of doctors in this?
Charles, doctors say we are indeed seeing a decline in the number of active COVID-19 cases nationwide. However, they have observed an increase in the number of patients with severe and critical cases. DOH data shows a decreasing trend on the number of daily new cases. From a 7-day moving average of more than 3,000 new cases in mid-August, the average dropped to around 2,800 in early September. Well, this sounds like good news. Philippine College of Physicians Vice President Dr. Maricar Limpin says more severe and critical cases are coming in. Patients with severe cases are those who are already experiencing pneumonia that needs to monitor their oxygen level, while critical patients are the ones already in need of life support like intubation. In the last 2 weeks, as much as 1.4% of the total number of confirmed COVID cases were severe, and as high as 3.3% were critical. Dr. Limpin says this could mean that more patients are given necessary treatment, but it also means that individuals have come for healthcare at the later stage of their condition. Limpin advised individuals to immediately coordinate with barangay health officials and other primary healthcare institutions so that measures may immediately be done even before their conditions get worse. The Philippine College of Physicians and the Philippine Society for Microbiology and Infectious Diseases are part of the group called Healthcare Professionals Alliance Against COVID-19. This is the same group that once asked the government to revert Metro Manila to a stricter community quarantine status. Meanwhile, the Health Department reports that as of Tuesday, 1,600 new COVID cases have been reported. Confirmed COVID cases in the country now stand at more than 291,700. Of the number, over 56,000 are active. 450 more individuals have gotten better from the disease, bringing the total number of recoveries to over 230,000. 50 people died of the virus in the past 24 hours, pushing the death toll to more than 5,000. Charles, the way the medical experts are seeing it, Metro Manila is not yet ready for a more relaxed community quarantine. They once again advise the public to do their part and strictly follow minimum health protocols. Charles?
All right, thanks for that. That was Greg Gregorio reporting live from Antipolo City. We'll have more stories after the short break. Stay with us. You're still watching One News Now. I'm Charles Lejano. Former Justice Secretary Vitaliano Aguirre once again denies involvement in the so-called pastillas scheme. Under the modus, Chinese workers are allegedly allowed to enter the country in exchange for money. During today's Senate hearing, media practitioner Ramon Tulfo presented photos of a helicopter purportedly used to deliver grease money to the former DOJ chief.
Meron po akong sama na loob sa kanya. Pero hindi na pong to the extent na ibunyag ko yung niya sa Justice Department.
But Aguirre was quick to deny this, saying Tulfo's claim was fueled by a personal vendetta and dirty politics.
Yung mga column mo, Puro hearsay. Wala kang sinabi. Pinaniwalaan mong you are taking hook, line, sinker. Malicious yan, Tulfo.
President Duterte wants to further lift the deployment ban on health workers, allowing those with existing contracts as of August 31 to leave the country. But a group of nurses says it is too soon to call this a victory, as only 1,500 nurses will stand to benefit. Jenny Dongan has the story.
Jordan was supposed to start working as a nurse in the United Kingdom last September 18, but because of the government-issued deployment ban on healthcare workers, his dream had to be put on hold. Jordan said he has already spent more than 100,000 pesos to complete his requirements.
Noong una, talagang sige, tanggap namin, okay, kailangan tayo ng Pilipinas, kailangan tayo ng gobyerno para magsilbi sa bayan. Pero as time goes by, parang naiipit kami. Hindi nila kami masisisi sa aming pag-abroad kung ang dahilan nito ay para lang may maihain sa pagkainan ng aming mga pamilya.
In his 5 years of working as a nurse in the Philippines, Jordan had only received a salary of 20,000 pesos per month. He said he decided to apply as a nurse in the UK as he would be earning 10 times as much. That's why Jordan could not hide his excitement upon learning that he is among health workers qualified to live and work abroad. President Duterte has allowed 1,500 health workers whose documents have been completed as of August 31 to live and work overseas.
Yung iba, maghintay-hintay muna kayo sandali. Kinakalibrate lang natin yung paglabas ng mga, kasi kailangan din natin yung mga tao.
Presidential spokesperson Harry Roque said that while the government is under the state of calamity, the government will have a hard time to totally lift the deployment ban. He said the ban is not only meant to address the lack of medical personnel in the country, but also a way for the government to protect them. But Philippine Nurses Association Secretary General Jocelyn Andamo says relatively few health workers stand to benefit from this. She also insisted that there are enough practitioners in the country.
Partial victory para sa mga nurses, mga affected nurses na matagal nang nakikipaglaban para mapayagan silang makaalis at makapagtrabaho abroad. Meron pa tayong natitira na hindi bababa sa 240,000 nurses. So, kung sinasabi na kailangan nating tumulong sa pandemya, we have enough nurses waiting to be maximized and tapped by the government.
Andamo added that health workers should not be blamed for seeking better opportunities abroad. She says if the government really wants them to stay, they should be provided competitive salaries and benefits. For News 5, Jenny Dongon, We Are One News.
A grade schooler in Quezon City takes matters into his own hands as he finds a way to save up for a gadget that he can use for his online classes. JC Cosico has the story.
With only a few weeks before the reopening of classes, some students are maximizing their time to rest and play. But spare this kid from Barangay Payatas in Quezon City. 9-year-old Gilbert Eboy Bandillo makes the most of the prolonged school break of weaving and selling rags. His goal? To save up for a gadget which he will use once online classes begin.
Para po may message kami para kung hindi namin alam yung subject niya.
Eboy, an incoming grade 4 student at the Melencio Castelo Elementary School, learned to weave rags when he was just 7 years old. His 56-year-old grandmother Angelita, who runs a small sari-sari store, taught him to do so. Each rag costs 25 pesos to 45 pesos, depending on the size and design.
Hindi na katulad dati na kahit ganyan lang yung paninda ko, konti lang, pero mabilis ko mapaikot, sir, kasi mabilis ko lang maibenta.
Ngayon?
Ngayon, matumal talaga, sir. Walang pira mga tao, sir, eh. Mahirapan kaming bumili ng sarili nilang gadget kasi iinuna nga namin pagkain namin.
Eboy's father, who works as a tricycle driver, admits they could not afford to buy a gadget for his son.
Mahina po yung aming pasada ngayon sa tricycle. Gawa nga po nung pandemic, no? Tapos alternate po yung biyahe namin.
Some of Eboy's neighbors offered help by selling their rags online, just like Abigail, who said customers are satisfied with the products.
Ayokong kaawaan yung bata. Kasi yung bata, kahit siya pag sinasabi, Itabi, hindi naman tayo mukhang kawawa dun, di ba? Hindi naman tayo nagpapaawa. Gusto ko lang pakita na gumagawa akong basahan. Marunong akong dumiskarte. Yun lang naman gusto ko eh.
Eboy has a message to kids his age.
Dapat po, hindi po sila gala ng gala. Kasi, lalo na po ngayon may COVID-19 po. Kailangan po nilang dumiskarte para hindi po sila, hingi po sa magulang nila.
The Education Department has time and again said that gadgets are not required under the distance learning setup. It cited other learning modalities such as printed modules, radio, and TV. To those who want to order Eboy's products, they may visit their Instagram page at Angels Rags. For News 5, JC Cosico, we are One News.
For more updates, follow News 5, the Philippine Star and Business World online. Visit our website, onenews.ph, for in-depth analysis. And you can catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime and anywhere. I'm Charles Lejano. We are One News.